As a nurse, when we talk about breast cancer, one of the most important things to understand is this. There usually isn't a single cause. It develops from a combination of genetic, hormonal, and lifestyle factors that influence how breast cells grow. And let me walk you through it in a clear, practical way, like we would discuss it with a patient. Some people are born with changes in their genes that affect how their body protects against cancer. These genetic mutations can be inherited and may increase the risk of developing cancer and manage individual risk. The most well-known are BRCA1 and BRCA2 genes. These genes usually help repair damaged cells. When mutated, the risk of cancer increases significantly. Your risk may be higher, but it's important to say clearly, most people with breast cancer do not have these inherited mutations. If you have a strong family history of certain conditions, or if relatives were diagnosed young, talk to your doctor about genetic testing and early screening. It can make all the difference. Estrogen influences libido, memory, and mental health. It supports breast development and increases cholesterol in bile and fat stores. It helps with bone densities and muscle sclerosis and supports ovulation, the uterus, and vaginal health. Breast tissue is very sensitive to hormones, especially estrogen. Longer exposure to estrogen can increase risk. This includes blood clots, stroke, and certain cancers. Please consult your doctor about these risks. Starting periods early, before age 12, can increase certain health risks. Late menopause, after desacral, and long-term hormone replacement therapy is another one. Hormones can encourage breast cells to grow more, which increases the chance of abnormal cancerous changes over time. Exogenous and endogenous sources create mutagenic lesions, leading to DNA damage. This causes cytotoxic lesions or cancer, or resulting in cell death, senescence, and aging. Age is one of the biggest risk factors. Most breast cancers occur in women over 50. As we age, cells accumulate damage, and the body becomes less efficient at repairing it. This is why regular screening, like mammograms, becomes more important with age. Lifestyle and environmental factors can increase your risk, so prioritize your health. Hormones produced by adipose tissue. White adipose tissue stores energy and produces estrogen, cytokines, leptin, and resistin. Brown adipose tissue generates body heat. Certain lifestyle factors can increase risk over time. Alcohol consumption, being overweight especially after menopause, lack of physical activity, and smoking, which contributes to cancer risk overall. These don't guarantee cancer, but rate him a likelihood. Previous breast conditions or exposure. This shows external radiation therapy. A radiation source directs radiation at the tumor. The tumor absorbs the radiation and begins to shrink. This treatment precisely targets cancer cells. Other contributing factors include previous breast cancer or certain benign breast conditions, and radiation exposure to the chest, especially at a young age. Breast cancer is not called one single thing. Many people who develop it have no obvious risk factors, and many with risk factors never develop it. What matters most is being aware of changes in your body, attending screenings, and seeking help early if something feels different. Let's talk about the sign. When we talk about the early signs of breast cancer, the key thing I always tell patients is this. And it doesn't always are subtle, so knowing what to look for really matters. This is the most common early sign, a lump in the breast or underarm. It's often painless and feels different from surrounding tissue. It may feel hard, irregular, or fixed in place. Here are the symptoms of early breast cancer to watch for. A lump in the breast or armpit, inverted nipple or nipple discharge, breast dimpling or skin texture changes.
We will continue. Please subscribe. Thank you.